we're going to talk about a lot of stuff today. But first, I want to kind of go into your story a little bit. So you were at SpaceX for a number of years. You left in 2018, and you went into finance, as we were talking about the other day. Why?
Yeah, so I kind of fell into it, quite frankly. I told the story over beers, which is more than the 25 minutes we've got. But I always wanted to learn about business, and the way I learned about engineering was physics and the laws of physics allowing me to build things. So I thought, okay, well maybe if I learn about business, I can build companies. And so I was playing around with various businesses, most of them embarrassing, everything from like an almond milk delivery business to bath mat sales to starting finally got one that was somewhat successful down the street, an engineering contracting and consulting firm. And then I thought, well, the way I learned about engineering in school was I did undergrad in physics and then a grad work in systems engineering, which is like a high level of abstraction. So I interpolate in between. So I figured with some of the startup experience I had, combining that with investment banking experience would also give me a low level, high level, interpolate in between. So as Varda's going through 600 people, I'll have no idea what I'm doing. But at least once I get to the other side, I will,
Yeah. So when you were at SpaceX, you were already sort of thinking about like an entrepreneurial future for yourself?
Yeah, absolutely. I would say after about 5 years there, the reason I joined SpaceX was there's this large sense of adventure associated with working there. And so the yearning for adventure and startup and starting a company seemed like the adventure of a lifetime, and it is.
Yeah. Yeah, I mean, I think SpaceX, like when I think about 2018, SpaceX, Falcon Heavy was launching for the first time. Like there were a lot of, was it hard to leave amidst like that excitement and that like high stakes kind of engineering project work that you were doing?
Absolutely. It's like leaving college when you don't have to graduate, where you're like, oh, I'm going to leave all my friends now. I've had a blast. I've learned a ton. This is all I know for the last 5 years. And it is always exciting. So it really takes like a leap of faith of like, let's see what else is there. And of course you can always go back.
Yeah. I thought it was interesting that you said you had lots of different ideas that were not related to the space industry, like almond milk delivery and things like that. So you were really open to exploring the future in that way.
It's kind of funny that the ideas that I tried that seemed way more simple, then it was like, all right, well, let's try space drugs, and all of a sudden that was the one that worked, But I figured the way
mats didn't work out. Space drugs worked
Learned
out.
a lot during them, but the way I thought about it was like, hey, this idea makes sense. I'm just going to pursue it until it fails, and then learn why it failed. So for each of these, it was like, if I can't figure out why it wouldn't work, I'm just going to go do it.
That's cool. I mean, I feel like that that's a lot of like failure exposure, which is probably a good thing.
Yeah. Shamelessness.
Yes. Yeah, indeed. So I've heard before that the idea for Varda was actually your co-founder Delian's kind of idea.
Yeah.
What did he like? Tell me how he pitched it to you. What were those conversations like, and what did he say to make you go, okay, let's do this?
Yeah. So let's see. So it was his idea. He works at Founders Fund, and they were one of the original investors in SpaceX. So they noticed reusable rockets. They had been tracking that for decades, and when they started to really catch traction, there was repeatability. Then they knew already that manufacturing in space was now economical. And so he reached out to me looking for someone with my profile, someone who'd worked at SpaceX before, who had started companies before and was willing to drop everything and go on this adventure with him. And so I checked all three of those boxes. I was not a hard sell.
Okay. Yeah.
So I was already looking to leave the bank to do a startup, and I had a few that I was working on to see which one came to fruition. And his idea blew them all away. And I was looking for the adventure of a lifetime. And so he was like, space drugs. And so we spent like 3 months figuring out what the business plan would be, what the system architecture would be, who would we hire. And he said no promises other than a pitch meeting. And so that was enough for me to quit my job and give it a whirl.
Yeah, I think that's such a funny story because you're right. Like to some degree, it is like one of the hardest challenges, like reentry and let alone kind of the pharmaceutical drug manufacturing in orbit. And yet that was the one that you decided to kind of take the risk on. Which is
yeah,
cool.
Absolutely. It was funny that he thought So I thought the biggest risk was being able to capitalize it, and he thought the biggest risk was being able to build it. And I was like, well, I can build it if you can capitalize it. And he was like, well, I can definitely capitalize it if you can build it. So we're like, all right, we think the risk is on the other person, so we're in.
Okay, talk to me a little bit more about the business model. I feel like it's not quite as intuitive as it might sound. Like, you are not selling gravity as a service, for example. So talk to me about Varda.
Right. So what we do is we use microgravity to make new drug formulations that you otherwise could not make on Earth because of gravity. So gravity is fixed at 1 g. That's the reason why we don't float into the air. But really, I think the way to think about Varda is forget about space for a second. It's actually the most confusing part about Varda. If you think of it just as a zero gravity bioreactor. So imagine we have a traditional bioreactor or even an oven that has a temperature knob, stir rate, other things to make drug formulations, and now we just add a gravity knob. So in the same way that refrigeration brought a temperature knob to the pharmaceutical industry, Varda is bringing a gravity knob. Forget about space for a second, right? So we just have this magic oven in the back of our warehouse where you can create formulations that you otherwise couldn't. And so what I mean by that, a formulation is an IV bag or a shot or a pill or an inhalable. We don't discover drugs or make new molecules. We just increase the list of formulations you can make because our reactors have a gravity knob. In the same way that if you add a temperature knob to something like an oven, you can make a whole new world of recipes that you couldn't make just on a dry shelf. And so the idea about now layer in space, because the only way to reduce gravity is to go into free fall. That's Einstein's principle of equivalence. You cannot do it on Earth. And so, pay no attention to the rocket behind the curtain. We use SpaceX instead of FedEx, but if you just imagine us shipping to a bioreactor in Milwaukee that happens to have a magic zero gravity knob on it, that is really what Varda is. And then it kind of starts to make sense where it's like, okay, we look like any other company like a Halozyme or something like this where they make formulations for pharma companies where the pharma company ultimately owns the drug and they're just providing the formula.
Right. Yeah, I think it was around when your Series C was announced, and I understand some of that money was going to building out like a pharma lab. Is that
That's right? Yeah.
Yeah, I think it was around that time that I was like, oh, these guys, it's really not quite accurate to say you're a space company.
Right.
Like, that's not actually capturing what's going on and what their vision is and what they're planning, for the future.
Totally. There's a Jay-Z quote of, I'm not a businessman, I'm a businessman. And in the same way, exactly. So we at Varda, we're not in the space industry, we're in space industry. Ultimately, it's just another place to ship to. And that's like one of the switches to really flip in your head about Varda and in really any new age space company is that shipping to space is becoming just shipping. I heard Beju say it earlier, it is underappreciated what access to LEO or low Earth orbit is now. It truly is because, I'll give you a couple of anecdotes. So 10 years ago when I was at SpaceX, the number of global launches before Falcon took off, no pun intended, the number of global launches was the same as the number of daily flights out of Napa Valley Airport.
Wow.
And today, the number of global launches, the number of daily flights out of LAX. So if you think about the airport being represented as the size of the city, and the number of launches being represented the size of the space industry, the industry basically went from Napa to LA in the last 10 years. And before, 10 years ago, you would have to get a chartered flight, essentially. It was like hitchhiking to get to orbit if you were not a primary mission payload. Whereas today, you can, it's still expensive. It's still, $2,000 a kilogram, but it's dependable. Like, you can book we've booked launch years in advance, and it launches on that month. And being able to do that has converted space access from hitchhiking to shipping, albeit expensive, but at least you can build a business on top of that dependability.
Yeah, absolutely. There is also, we just talking about how maybe you're not exactly a space company, but you do also have this other kind of business unit, which is hypersonic testing. So talk to me about that.
Yeah, actually, one last thought just to think about for pharma, and then I'll go back to the hypersonics is, you're right that most of the Series C capital allocation went to pharma, and the reason for that is because nobody buys microgravity yet.
Yeah.
So we have to make something with microgravity that we can then sell, and drugs make the most sense because they're the most valuable chemicals per unit kilogram. We have a unique way to manipulate that chemistry in orbit, and there's a large market to scale into. So we built this pharma lab essentially to act as the abstraction layer between a pharmaceutical company and microgravity to produce that value using microgravity for the pharma company.
I think Just
Yeah, yeah.
really quickly, when you said nobody buys microgravity, I think that's a really good point, and something I think about when I look at other companies kind of in this field that I wonder about with their business models. Not, naming any names, but like also no one really buys re-entry.
Right.
And if that's your business proposition, like who is buying that?
Exactly.
You know?
Yeah. So we don't think of ourselves as a reentry company in the same way
Right.
we don't think of ourselves as a microgravity company. We think of ourselves as a hypersonic wind tunnel.
Mm-hmm.
Because if you think about it, there's only 3 corporate entities ever to bring something back from orbit: SpaceX, Boeing, and now Varda. So it's very few things are traveling through the atmosphere at Mach 25. And it's an environment between the plasma and the heat and even the chemistry, because you're ripping apart molecules, that you simply cannot replicate on Earth. And so we offer a hypersonic wind tunnel that you can't buy on Earth to the Air Force, and then our wind tunnel is just the capsule moving through Mach 25, and we can put sensors or new equipment that they want to test through that environment in the same way they would a wind tunnel.
Mm-hmm. So talk to me a little bit about working with the pharmaceutical industry. What were the kind of any lessons learned or things you kind of had to grok with, maybe norms that are different than the space industry?
Yeah, it's definitely a bigger corporate. So the pharma industry dwarfs the aerospace industry from a TAM perspective.
Yeah.
And as you can imagine, with any industry, it's kind of fractal in nature with like subcultures and subcultures. Now, the way to get into the pharma industry from a Varda perspective was through the scientists, because they had been sponsoring many of the experiments that have been going on the International Space Station. And so they already were huge believers in this whole concept. And then from there, bridge out to the BD folks and start that conversation that way. But luckily, BMS, Merck, a bunch of these companies have flown experiments on the ISS that were ultimately the rationale for starting Varda.
Mm-hmm. Right. The core principle is not unheard of, and it was happening on the ISS.
Right, exactly.
Yeah. We've talked about pharma, and you've called it, I think in another interview, you said it was like the obvious first market.
Yeah.
Are there any secondary markets you guys think about?
Yeah, so if you think of it from dollars per kilogram and a large market, and we should talk about why the large market matters so much, and can you manipulate this chemistry with microgravity? And if you think of that as your filters, then the first 200 out of 300 things are just different drugs. And then eventually you get to things like semiconductors and fiber optics and this sort of thing.
Yeah.
But ultimately, gravity is a fundamental force of physics, and there's only 4 fundamental forces. So being able to turn a knob on that fundamental force is big for manufacturing. The only reason we're starting with pharma is because shipping costs to space are still high.
Mm-hmm. So the business proposition for something like semiconductors and fiber optics, is it just not quite there yet, but one day you could see, yeah.
Exactly. The research has already been done on the space station, and now it's just a matter of time for launch costs to drop where it becomes to make sense like it does for pharma now.
Yeah. Okay, so, just a little bit ago you called it the adventure of a lifetime. Talk to me about a near-death experience. I want to hear, when did you come close and what happened and how did you get out of it?
So the stereotypical near-death experience for Varda probably happened during our first mission, where we launched our vehicle. We're in orbit. Everything seems to kind of work, but of course, re-entry is the ultimate arbiter of success. And we got essentially stuck in orbit for 6 extra months because we were unable to get our re-entry license. And ultimately, the reason we weren't able to get our re-entry license is because we were a low priority at our landing site, which was the Utah Test and Training Range. Their mission is to test weapons and train warriors, and so space drugs does not fall into that category. So we were not a primary customer of theirs, and so when they had to bump us for a higher priority, moving that date meant that it invalidated our re-entry license, which we can't really tell the world of all these details, and so it just looks like Varda is not approved to re-enter, right? So
right.
In that situation, it was near death in the sense that there was 80 people in the office that had all spent 2.5 years of their life on this thing, and it's in orbit, but we're not sure if it can come home, and even if it can, we haven't, that's still the test flight.
Yeah.
So does it work, right? So that was a moment of kind of leaning in the sense of we continued production at risk of the next build and the next build of the vehicle, and continued growing the business and hiring, betting on success essentially. And Whew.
Yeah. Yeah, I mean, I think something that's kind of interesting about that story that, like the haters don't maybe know, which is that the FAA authorized you to launch even though you didn't have, the reentry license. Like, it's not as if, you were sort of, they understood that you didn't have it. People on the internet were like, why would you launch without being able to re-enter? Like, that's dumb. And
Yeah, we did have permission, explicit written consent from the FAA to launch, because they saw a path to re-entry, and ultimately, even though they are regulators, their charter says to foster the development of the space industry. So, as much as their priority is public safety, as it should be, they're also cheerleading for our success.
Yeah, absolutely. Was it the case, like, or to what extent was it the case that there was maybe it was simply that this was new and had never been done before, or was there something that maybe folks in Utah just were not understanding or appreciating about kind of the commercial enterprise?
All of the above. So it was new in that it was the first commercial reentry on land ever, and there was no process for the Utah Test and Training Range to also talk to the FAA, because it had never been done before, and so both entities felt like they were taking on all the risk. So the FAA and the NTSB say, hey, if this piece of debris hits someone, it's on us. And then you go over and talk to the commander at the range, and they say, hey, if this debris hits someone, it's on me. So now we have to do risk mitigations in both of their languages duplicatively, because there is no process to say that where the risk lies, because it was the first of a kind. And so on top of that, but that part's okay in the sense that I remind the team that if you're doing anything with respect to cutting edge technology, then like by definition you're also going to have to push regulators, because it's not like regulators are writing regulation for what could be. So I kind of remind the teams like, hey, this is a good thing. Like, you have to push regulators. That means you're pushing boundaries in general. But then of course there's culture clashes in the sense of like the military, you can imagine yourself as in the military. That's a different culture than a tech startup, and for very good reason, right? Like, you need top-down ordered control in the military, and you want bananas risk takers that are not listening to authority in the entrepreneurial world. And so those two cultures are indicatively different languages that you have to then translate.
Yeah, absolutely. Yeah, I mean, I think among the successful space startups, like, one thing they have in common is a lot of their hires are just like ex-government folks who can speak that language and who can, sort of code switch, to use that phrase,
yes,
and like,
exactly.
Sort of help the company and the founder like translate the risk into a sort of language that someone like, a two-star general or something can kind of understand and not feel freaked out by.
Totally. Yeah, absolutely.
Yeah. I mean, I think, the big risk of it, though, the payoff is potentially, of course, so high. And now you've gone to Australia. So when did you start conversations with Australia? Was this when you were stuck in orbit and you thought, we need to find somewhere else?
Yeah, exactly. We were banging on all cylinders trying to figure out a solution to lasso this thing down from orbit. Everything from, should we do a water landing, to Australia, to the Choctaw Nation. Was someone a group that we also talked to, because they have a large area of land, very interested in aerospace, ironically, and so basically any way to get this thing home.
Yeah. The water landing, what would be the downside of that?
Capsule doesn't float.
There's so much water. Oh,
and we would lose it, right? And so it was like, and we knew this was possible, so it was like, either like you have to push the boundaries of regulation to create this future, and so it was like, instead of squeezing around and doing a half measure, we were like, no, like, in order for Varda to be successful, we need to land on land regularly. And so just suck it up and like, let's figure this one out on this one.
So would you say the process here in the States has been sort of figured out, so that in successive Varda launches, like, you understand now with the FAA and all of these different bodies, like, how it would work?
It's definitely a known problem now, and there's now legislation that acts as the process for one range communicating with the FAA. It actually already existed for Vandy and the Cape, of how they should split risk with the FAA. It just hadn't been done for all national ranges, so we basically asked for that to be copied and pasted to all ranges. There's still a lot of improvement to do for regulations so that it becomes more standard rather than having to analyze your safety from first principles every single time. But once you get over the hump of showing that you can do that, then the FAA can bless your methodology. And once the methodology is blessed, now we can just print flight safety analysis so that they're only checking the output rather than our calculations. And so once you get that, that's kind of over the hump of now regulatory is not exactly on critical path of Varda's destiny like it was a couple of years ago.
Right. It's interesting that one of the solution pathways is legislation. I didn't quite realize that it would have to be legislatively changed.
Yeah, so we talk to members of Congress quite frequently, and that's probably item number 3 these days, but it was item number 1 at the time.
Yeah.
Yeah.
What's item number 1 and 2?
Item number 1 is probably the first thing I love to talk to members of Congress about because they actually get this. A lot of them are more future-facing than you'd think, or future-thinking, but it's basically like this 7 domino theory. I'm still working on the name, but it's basically like, let me paint a picture of the future and cross-check me on the logic, and if you agree with the logic, then we agree with the future, you know? And so the way I explain is like, reusable rockets is the big first domino. Now shipping to space is just shipping. Can we make drugs in orbit and bring them back? We did that on our first mission. Then getting our first drug into the clinical trial is the next domino. It's a big deal because what it means is perpetual launch. And this is a really big deal for the aerospace industry because right now, every other company thinks of launch as a capital investment, right? Sirius Satellite Radio, DirecTV, even Starlink. Once you put the constellation up there, your demand for launch saturates. But like even with a few drugs on the market with Varda, we have a perpetual demand for launch. So we call up our launch provider and say, hey, the more we launch, the more money we make. We'll take as many as you got. And so perpetual launch is a huge deal for the aerospace industry. And then if you factor on top of that, which is this next domino of a positive feedback loop. Like right now, in order for us to make a drug, it's got to meet a $1 per kilogram threshold of value. So there's only a fraction of drugs that are on the market today where they're valuable enough for us to reformulate them in space, like going from an IV bag to a shot. But by servicing those drugs, we lower our costs a little bit because you get economies of scale, which means now all the drugs that were between those two numbers are now viable. And so you make those drugs now, which gives you more scale, which lowers costs again. And so you get this positive feedback loop where the more drugs you make, the more scale you have, and the more scale you have means the more drugs you can make, which is just going to shove launch costs into the ground. And so when you have perpetual launch, you have a positive feedback loop. And so, you know, I tell the team, like, eventually launch costs will get so low that it truly is like shipping to Milwaukee. And then you'll really start to think of, like, space as just another place, essentially. And then, like, that's the ultimate goal of Varda. Like, from day one, our mission statement has been expand the economic bounds of humankind because you'll know we're successful when the launch costs are so low that it's actually cheaper to put a working class human in orbit because creating additional automation would be more expensive.
Yeah.
And so I imagine this like, you know, Jane goes to space for a month. It'll be like an oil rig. She works at the drug factory for a month, comes back down, and she will be the first person ever to go to space and back where she generated more value than the cost to take her there. It was literally too expensive to keep her here. And it's at that moment when like the invisible hand of the free market economy lifts us off our home planet.
I'm going to be honest, that is really hard to imagine anytime soon. Specifically the human capital being cheaper, you know, like what kind of time scale when you pitch this to legislators, like what are you pegging that to?
I think it's about 15, 20 years, if I'm being honest.
Okay.
And the reason I say that number is because if I think about 15 years ago, that was, you know, I remember the first rocket I worked on SpaceX was Flight 3 of Falcon 9. And if someone had told me reusable rockets and as many flights as daily flights out of LAX, I would have been like, all right, 15, 20 years. And this feels the same level of futuristic as that, where it's like, okay, I see a technical path there, I see a business path there, but there is time to do it. Same thing with reusable rockets. And so I think that's, you know, it's definitely less than 30 and it's definitely more than 8.
Okay.
I was going to say 10,
years.
but I was like, come on, we can do 10.
Okay. So last question then, does that include a future of like a human-rated Varda capsule?
Ultimately, long term, yes.
Like long term,
right?
yeah.
Long
Eight to
term,
30, in 8
right?
to 30
In the
years.
8 to 30 time frame.
Yeah.
What I think the near term, what success looks like, is you can go to our landing site and you see multiple shooting stars per night with space drugs coming back. So we've created 3 so far. You know, on average, there's there's 3 Starlink satellites launched every day. And so if we can hit 1 a day for a vehicle that's roughly the same size and complexity, that's a big win, and I think that'll push launch costs down to enable that future.
Awesome. The future's bright. Thank you for being here, Will.
Thank you, Aria.
Awesome.
Yep.